Welcome to another episode of Easy Access to Healthcare for All, a program which brings you news and issues around the National Health Insurance Scheme. NHIS takes its existence from the law. The law prescribes how it is to be governed, its operational processes, organizational structure, and culture. It is often stated that a major impediment to the scheme attaining universal health coverage has been the law, with special reference regarding the mandatory nature of health insurance. This has prompted stakeholders to push for the amendment of the NHIS Act. What are the highlights of this amendment process? These and more will be our focus on today's episode of the program. My name is Aisha Muhammad Ahmed, your anchor. Please stay tuned.
Easy access to quality healthcare for all. NHIS.
First on the program is a highlight of events around the NHIS. Top in our news, Senate reconsiders amendment to the NHIS law following President Muhammadu Buhari's observations. These and more coming up shortly.
The Senate on Wednesday, 1st December 2021, recommitted the National Health Insurance Act Amendment Bill 2021 to the Committee of the Whole. This followed observations from the President after the bill was sent for assent. The President, after critical examination of the bill, raised some fundamental issues which, according to him, required fresh legislative action to clauses 2024 subsection 2 and clause 25 subsection 2 to provide for the administration of the Basic Healthcare Provision Fund as well as the Vulnerable Health Fund. Deputy Senate Leader Senator Boniface Ajayi presented the President's observation before the Senate.
Desirous of the need to address the President's observation and make necessary amendments, and relying on Order 1B and 53B of Senate Order. Accordingly, the Senate rescinds the decision on the affected clauses of the bill as passed and recommits same to the Committee of the Whole for consideration and passage.
Chairman of the Senate Committee on Health, Senator Yahya Oloriegbe, provided further insight to some of the amendment and why they were necessary, even as other senators commented.
Wanted is a kind of special fund allocation. Otherwise, the Vulnerable Group Fund will not have funding to take care of what it's supposed to take care of. More than 70% of Nigerians are poor and they don't have access to insurance. They are not in job. We want certain kind of money. That's why that tax was created. But because it is not in line, I want to suggest, Mr. Chairman, support your suggestion that it should be in special intervention fund appropriated by, we can say appropriation by the National Assembly, but it means it's a special fund, but I want allocation to be there as well by government and appropriated.
The bill was thereafter considered, clauses amended and passed by the Senate.
Welcome back. Just like we saw in the news, efforts are still on to give Nigerians an NHIS Act that ensures and assures of giving every Nigerian access to social health insurance. In our next segment, Issues around the NHIS, we shall bring you updates on the amendment of the NHIS law, efforts put in place by the scheme and stakeholders to achieve the attainment of the universal health coverage in Nigeria, amongst other matters guided by the law. Don't go away.
Easy access to quality healthcare for all. NHIS.
The NHIS was established to ensure financial access to healthcare delivery services. Since its inception in 2005, the scheme has continued to put measures in place to deliver health insurance to Nigerians. Statistics, however, show that less than 6 million Nigerians have been covered under the NHIS. Some of the impediments that have worked against the achievement of universal health coverage include the law that was enacted as Decree 35 in 1999 NHIS.
The major challenge that militated against NHIS not covering the entire population is the law establishing the health insurance, which is made voluntary. So it's when you like, you join. When you don't like, you opt out. Because of the provision of the law being voluntary, at the initial stage of the health insurance, of the implementation of the health insurance, the state actors refused to join. Local government actors refused to join. So the NHIS is just left for the federal government employees, because the federal government has accepted the fact that they will contribute for them. Then the organized private sectors that are willing, they join. But those that are not willing, they do not join. So that's the major reason why NHIS could not be rolled out to the entire population.
There was unanimous agreement within the stakeholders in the industry that the Decree 35 be amended to reflect current realities. Barrister Blessing Yenge, General Manager, Legal Department, speaks on the Act as it relates to healthcare delivery.
The law says we should deliver healthcare to all Nigerians. We should insure all Nigerians. But we have a challenge there because it does not compel every Nigerian to participate. To some extent, we have achieved the purpose for which we are set up to, but we have not achieved in totality.
Barrister Nyenge gives an overview of the law establishing NHIS from the decree to the Act, while highlighting the importance of the amendment.
This law should become mandatory to participate in health insurance. This entails all public officers, those in the private sector, the vulnerable groups, where you cannot, maybe due to poverty or disability or other reasons, then the government should pay for you. The second area that will receive a boost is the funding of NHIS. There's something we say innovative healthcare financing. So in the new law, in the proposed amended law, we are going to have areas that will boost our funding. For example, it is stated in that law that if the president approves, one kobo per GSM call will be coming to health insurance.
A key player who also spearheaded the amendment of the bill is Senator Yahya Oloriegbe, Chairman, Senate Committee on Health. He speaks on how far the scheme has come in terms of coverage.
We have two huge sectors that without us covering them, we cannot achieve universal health coverage. That is informal sector and the social sector. The informal sectors are every other person that engage in non-formal activities. That's a huge one. Market women, vulcanizers, mechanics, bricklayers, everybody, traders who trade in anything. Those ones are informal, they're not well organized. But then in the informal sector, including even when you have cooperative societies and so on, people that live in everywhere, who earn one form of living or the other, who earn one form of income, no matter what small. That sector we've not covered much under our health insurance. Then we have social sectors, which is the vulnerable group, those that don't generate income or who don't have any access to income. Well, when we talk about social sectors, we have to talk about children, and then we talk about pregnant women and so on, who are vulnerable groups. But you talk about the indigent populations, those who are poor. And we know the poverty index in Nigeria is very high. I mean, they talk as much as say we have up to 70% of the population or 65%, depends on which figure you are looking at, who are living below poverty line. For these people, they need healthcare, and we have to cover them in one way or the other. So when you say, how do I describe? So the description will not be It's just from this, what I've given this explanation, we can know what is happening.
Senator Oloriegbe speaks on the essence of amending the Act establishing NHIS.
Because we need to achieve universal health coverage, where we said, by universal means it is that everybody that requires health is able to get that services at the point of need without being endangered by financial catastrophe. But that is, we have to reduce out of pocket. And to do that, it means we need an effective compulsory health insurance for the country. The word compulsory may not be the thing. What I want to use, the appropriate word should be available to all, if I can use that, in which case it is mandatory rather, so that everybody has that coverage. That's number one. Number two, just like I explained in the last instance, the scheme that NHIS has been implementing over a long time is that former public sector, and then we have the former private sector. The social sector has not been provided for because somebody has to pay for insurance. Is not that it means there must be a payment of premium. It's a pool system. It means you pool resources from everybody for everybody. From everybody. When I say from everybody, it means everybody must contribute. So now, when you talk about contribution, I've mentioned that we have a lot of people living below poverty line. They have to be contributed, but they will be contributed for by governments at all levels and by other means. So the former health insurance law does not provide for that social safety net. Of course, we have a law that tried to make some money available, which is the 2014 National Health Act, which provided 1% of federal government consolidated revenue fund to provide insurance for Nigeria. But the total money from that is very small to cover everybody. So we need to look for other sources of funding. For this is why we need to amend the law.
Since health insurance is a game of numbers, the more the subscribers, the more the pool of funds. Senator Oloriegbe says the new law will help the scheme achieve universal health coverage as it will make health insurance mandatory for every resident of Nigeria.
Oh, definitely on the long way. One, as I said, we have more resources and we have covered major sectors that are excluded now. With that, if we are able to bring those vulnerable groups under the social fund into the system, we'll be very close. And then the other schemes that are established, the informal sector schemes, the various other schemes that the NHIS will be able to establish using the instrumentality of the law will enable us to achieve universal health coverage.
We have gone through legislative processes. It started with the public hearing at the National Assembly, followed by a concurrence. The law was passed by the Senate, and it was concurred by the House of Representatives, and now it is awaiting assent by the President and Commander-in-Chief.
Besides making health insurance mandatory in the country, other improvements have been made for the effective performance of the scheme's regulatory roles. Speaking further, Suleiman Ibrahim of the NHIS says, one important part of every policy is to have an appropriate legal framework that will help it run, as the absence of one will deter the achievement of its objectives.
If you go to section 16, subsection 1, you see again that in that provision, that section is saying that, where an employer has 10 employees, okay, that such employer is expected to, key into but the word key into the health insurance program. In other words, they should be covered. But clearly there is a challenge with that provision because of the use of the word may. And the legal implication of the word may is that it gives you a discretion. You have a choice. When you are told you may do A, B, C, D, it means you have a discretion. But where the word shall is used, it compels, it sends the message of compulsion. So the extant law, we have had so many people talk about this, and the common consensus is that by virtue of that particular provision, NHI is not mandatory for people to just simply key or enroll in. They have a discretion.
Bringing health insurance under one roof to help NHIS achieve universal health coverage, Suleiman explains further on the relationship between NHIS and the state laws.
There is no policy that can see the light of today without an enabling law. So when the state health insurance agencies came on board, NHIS had to even give them our template. We developed template based on our existing extant laws. We developed their laws for them and gave them as templates with the liberty to amend them to suit, how they want to run their insurance programs. So we, in a sense, can say that we gave them, the template to develop their own health insurance policies.
Welcome back from that timeout. Easy access to healthcare continues with our stakeholders segment. On today's episode, we had a chat with Dr. Jaff Mama, Chief Medical Director of National Hospital Abuja. Dr. Mama talked on NHIS, their partnerships, successes, challenges, and many more. First of all, he gives an overview of the NHIS.
The NHIS is a national health insurance scheme. Is an insurance service that's meant to capture ultimately 100% of Nigerians under a universal health coverage system that will ensure that out-of-pocket expenditures for health care is not the case. So as it is now, civil servants were the first to be enrolled, and they are actually benefiting from healthcare, whether routine or emergencies, fully, in most cases from all the hospitals that have registered with the NHIS. National Hospital has been involved with the NHIS from the inception, and we have over 20,000 enrollees on in our hospitals. Many of them, most of them civil servants, and in addition to our primary enrollees, we have several thousands more than that who are referred to us for secondary and tertiary care.
Dr. Jaff Mama also clears the air on reports that NHIS enrollees are usually discriminated against.
I think I would not call it discrimination. Nobody goes, particularly in a public hospital like National Hospital, nobody goes out to say, oh, NHIS, go this way, and enrollees, fee for service, go that way. Actually, if you have observed in National Hospital, you can go around and check. We actually don't separate them. You see, so if you go to our GOPD, whether you are fee paying or you are NHIS, you are on the same queue. Some people believe that you should separate them so that, they can have an advantage. But the disadvantage with that, I will tell you quite quickly, is that that is where you can claim to be discriminated against. I use the word claim. Because somebody has separated you, you can easily be identified on the queue, even by the doctor. Apart from the point of registration, when you come in to record your access, now we are electronically driven by EMR, by electronic medical record. Apart from that point where you are registered and captured on the electronic medical record, at the point where your case notes, digital case note becomes available to your doctor or your caregiver, he doesn't know again whether you are NHIS or another person, because the next patient may be fee paying, he doesn't know, he's not the one who collected the money, he sees a patient, he's attending to the patient, so there's no way of discriminating against you.
Dr. Momo, who called for the expansion of the NHIS to cover all Nigerians, commended the management, especially the executive secretary, on how he engages with stakeholders in tackling the challenges. He also promised to continue to collaborate with the NHIS to ensure universal healthcare coverage for all Nigerians.
My advice is that this scheme should be expanded instead of the current 5%, which is mainly civil servants, so that it will become 100% or close to 100% of all Nigerians who are employed, whether in the private sector or in the public sector, or whether in the informal or the formal sector, or whether you own your own business or you're a petty business trader. Find a way to get everybody enrolled so that the social network system can take care of the less privileged who are not employed. I will commend the new management, particularly the executive secretary, who has been very proactive in listening to providers, in particular like us at the National Hospital, and hearing our challenges, calling for meetings and interactive sessions which are unique, which is tenure, novel in the sense that stakeholders meetings are now regular. This was not the case, and you were able to then tackle issues as they arise. And there are standing issues, but those issues are being looked at by the management, and this is appreciated by the providers. And as colleagues in the service of the country, I commend him and his management for the good job he's doing, and we are trying to cooperate and collaborate to ensure that Nigerians benefit from this, and if the scheme is expanded to ensure universal health coverage, then of course we will actually be very happy, and Nigerians will be happy as well.
That was Dr. Jaff Momo, CMD, National Hospital Abuja, speaking on success of the NHIS towards universal healthcare coverage.
Easy access to quality healthcare for all. NHIS.
Coming up next, your question answered.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question: does this NHIS have an avenue for complaint?
There are avenues for complaints. We have our call centers, we have our state offices, and we also have some of our major program departments that look after complaints like enforcement, standards and quality assurance, and formal sector.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
I think I paid almost nothing.
It went easy. We only paid 10%.
We all work towards accelerating universal health coverage.
Everybody, irrespective of his gender, has access to basic healthcare services.
Easy access to healthcare for all every Saturday at 8 p.m. on the NTA network service.
This is where we draw the curtain on this episode of the program. Join us again, same time, same station, on another episode as we continue to bring you more stories of happenings around the NHIS. Universal health coverage for all Nigerians is a possibility. Enjoy the rest of your day. See you next week.
Easy access to quality healthcare for